Hello, welcome to LADA Life. I'm Linnea May Huxford, and today's topic is the mind-body connection. I would go beyond saying there's a mind-body connection. I would say it's all one and the same thing. The LADA diabetes has given me so many insights, and one of the biggest insights that I'd like to share with you today is that your mental state has a big impact on your diabetes. I see this personally in myself. When I am stressed out, I am more insulin resistant. My blood sugar tends to go up, and I need more insulin to manage my diabetes. A work day where there's a lot of stressful things, I need more insulin. A nice, relaxing weekend where I'm very calm, I need less insulin. That's the truth in what I observe in myself, and it should not be underrated or ignored how much what's going on mentally affects your body. And I use a continuous glucose monitor, and if you use the CGM, you've probably observed these things too. That how you're feeling mentally, how relaxed you are, or how stressed you are, affects how your blood sugar is doing. This is something that can be quite challenging if there's something big, traumatic happening, like a death of a loved one or a breakup, relationship stress. I saw this firsthand when my dad died, and I saw my CGM, my blood sugar immediately spiked when I heard the news, and it was not because I ate anything. So there's hormones that are released depending on your mental state, and these affect your blood sugar. And that's really why treating diabetes, there really should be a big mental health component to diabetes treatment and mental health support. There's a lot of things in popular psychology about like how you have a second brain in your gut. But I think that is really understating the connection here, that your brain is not, or your mental abilities are not just in your brain, that your brain and your gut are all one. The serotonin receptors, which are a very common receptor in your brain, are also in your gut. In fact, 95% of all serotonin receptors in your body are in your GI tract, your gut. They are in your intestines, your stomach. They are not in your brain. So a very common thing is medications like antidepressants that affect serotonin can also affect stomach, and you might have side effects like nausea. This is, I would say, not a like accident. It is affecting your whole system. Brain and gut are one. With a CGM, it's very apparent that your mental state does affect your body by seeing the blood sugar changes, and it's not only what you eat or how much you exercise, but it's how you're feeling and how you're coping with the stress. Um, and so there's a lot to explore here. And I studied neuroscience in college. That was my degree, neuroscience and behavior. And I'm getting back into the topic because it's so fascinating. And I wanted to share a story with you from Oliver Sacks, who is a great neuroscientist and writer. I wanted to share a story that illustrates that this mind-body connection is really something. This is from his book, his autobiography, On the Move. And I'm going to read you a small section here where he was studying migraine. And in migraine, people get an aura, which can be some visual zigzag phenomenon that they see before the migraine comes on. And it's typically a headache. But he explained it is not always a headache. He said he's describing this how he talks about this discovery to another scientist he was working with. And it says, let me read from the book. And then there came a strange episode. I would meet with him on Saturday mornings and tell him about interesting patients I had seen during the week. And on one Saturday, early in 1967, I told him about a patient who did not develop a headache after the scintillating zigzag that begins many migraines, but had severe abdominal pain and vomiting instead. I said that I had seen a couple of other patients like this who had apparently switched from headache to abdominal pain, and that I wondered whether one should exhume the old Victorian term abdominal migraine. When I said this, Friedman suddenly became a different man. He turned red and shouted, "What do you mean talking about abdominal migraine? This is a headache clinic. The word migraine comes from hemicrania. It means a headache. I will not have you talk about migraines without a headache." So Oliver Sacks, he was very big into studying the whole person and really listening to the person, what they reported, and listening to their story. And he made these connections that some people would have these symptoms that would typically follow maybe a migraine symptoms before the migraine, the headache, a severe headache. But in some people's cases, it was in their gut. There was pain in their gut. So that is just thinking about all this mind-body connection thing. It's all one thing. And if you look at things like irritable bowel syndrome, I wonder if that is also, a lot of mental impact there in causing those symptoms. So to go back to diabetes and LADA diabetes, or any type of diabetes, really, it can be a stressful challenge to cope with diabetes, and that's why we need mental health support. So I've been thinking about how this mind body amalgam or amalgamation is really a unification all in one, and that we need to treat the whole person for diabetes and really emphasize things like coping mechanisms and meditation, stress relief, maybe through therapy, journaling, exercise, and other things, because if you have this heightened stress going on in your life, it's going to be harder to control your diabetes. I can tell you a story about someone I knew that had type 2 diabetes, and he had a very, very stressful job, and got diagnosed with diabetes. He was also eating poorly, a lot of fast food and high food, high in sugar. And then he retired, and all that stress went away, and he also changed his diet, and for him, his type 2 diabetes went away. So stress can be enough in some cases to trigger diabetes, type 2 diabetes in some people. For type 1 diabetes or LADA diabetes, it is not quite that simple, since the underlying cause of LADA diabetes or diabetes or type 1 diabetes is an autoimmune attack on your pancreas, and the pancreas is not producing insulin. So unfortunately, usually from what I've heard, that it does progress to where you need insulin. That was certainly my case. It did take a number of years before I needed insulin. And then at first I only needed a little bit of insulin, and then I needed more insulin. So there is this whole journey for LADA diabetes. But even so, even today, where I see myself as mainly somebody with type 1 diabetes because my pancreas is not producing insulin, I do have days and weeks where I need more insulin, and then other times where I need less insulin. And stress does definitely play a role in that. Primarily, the most obvious thing in my life is looking at how much insulin I need on a weekend or a vacation versus during the week. Because during the week, especially in the morning, not only are there all these hormones that naturally cause a rise in blood glucose in the morning, but also it's like, okay, I'm going to work and I'm managing all these things and dealing with some stress, and it's like wake up and go go go, and that stress does require my body does require more insulin, or is more insulin resistant when I'm under stress. And there's, of course, more than just mental stress. There is physical stress as well. And we also see that if you're sick with a virus or an infection, that you often do need more insulin when you're sick with something like that. So anyway, I hope this was an insightful thing. This is one of many insights I've found from LADA diabetes and from monitoring my blood sugar with a CGM. If you have diabetes and don't have a CGM yet, I would highly recommend that you look into that, because seeing the graph and seeing what's really going on gives so much insight into your body, into your processes, and helps with treating diabetes. So I will talk much more about lots of different things in the future. Please subscribe if you're interested in this, and check out my book, Success with LADA Diabetes. Thank you.